I recommend. I'm so sorry. We're having some technical difficulties, some Wi-Fi issues. So we're gonna try to do this because I know that we weren't on last week, and so I'm afraid that there might be some burning questions out there for you guys. So I want to make sure that you can get them. So I have with me this week Dr. Robin Canizero. She's a holistic homeopathic veterinarian out of Florida. However, she can do consultations. If you don't live in her area, you can do consultations. But she's here and so valuable and so giving of her time to answer any questions that you guys may have. So welcome, Dr. Canizero. Thank you so much for being here.
Well, thank you so much for having me. It's always such a pleasure to do podcasts with you.
Yeah,
I enjoy it immensely.
It's fun. Me too. It's fun because I nerd out on this stuff. I want to know more.
It's like fill your ears with it.
Yeah, it's like school for me. It's like just going to school and learning more and more and more. I can never get enough of it. So I think it's great, and I hope for our listeners as they're coming on that they get a lot to learn from it too. But so I wanted to see. I don't know if there. Usually we have some time to talk about what you might want to talk about, but I was wondering how you felt about talking about yeast today. So I love it just is never ending. It's just yeast, like the yeasty ears and the yeasty skin. I had a dog in today. It was just, I just feel like, why can't we make this stop? It's just an epidemic and it's everywhere. And if I look on Facebook, it is every other question. My dog has a fungal infection. My dog, like, it's every other person. And I feel bad for people because I know it feels like to them, it's only their dog. No one else's dog could possibly smell like this or look like this. So I'm kind of discouraged in thinking that this will never end. Dogs will suffer from yeast infections the rest of their lives.
Well, that isn't exact. It is a frustrating problem we have. And yeast can exist on the skin. Rarely do we see it like in a urinary tract infection, but on occasion we can see yeast overgrowth in the gut. But basically, I think the important thing to realize is that we on the bugs, whether it's yeast or bacteria, as being the actual problem and symptom of the underlying problem. So yeast is animals have yeast on their body, in their ears. We all have that, but it's kept with an immune system that is competent and strong and supported by proper diet, medications and such, and things that will produce an overgrowth of inappropriate diet, like highly processed diets like kibble diet and food diets. The other things that could damage the balance of flora on the skin or in the ears or in the gut could definitely and over vaccinating, certain drugs, antibiotics certainly is a big one. Even antifungal drugs will actually shift the balance to more bacterial infection. So it's really important to realize that the use of these medications, while they're we're mostly creating the problem. This is not, animals aren't born having a yeast problem. A yeast problem from the damages that we produce in them, whether it's it's diet induced, and then what we do about it is all wrong and conventional. Men, oh well, they've got quote unquote an infection on the skin, and so what's the first thing they do? A steroid injection, and then they'll get some antibiotics and maybe steroids to go home. Alone not only damage the gut microbiome, which is the good symbiotic bacteria in the gut, but it also favors the kill off the good bacteria that can't keep the yeast in check. So whether you're using in the ears or orally doesn't really make any difference. We're going to damage those systems, the thing we're not treating. So then veterinarians or pharmaceutical companies got clever, and they said, no problem, we'll put an antibiotic, a steroid, and an antifungal bottle for the ears. We still aren't restoring balance in the ears. Many times with these medications, we're killing the good and the bad stuff, and we're the flora even in the ear canal. So I don't even favor my clients cleaning the ears except a little dirty or waxy. If they don't bother the pet, then don't disturb the flora in the ear. Be aware that if you're going to give your pet antibiotics and steroids orally or by injection, by itself is going to favor the increased production of yeast and the damage to the microbes. It's worthy to mention that when we damage the gut flora, that remember there's an intimate, the gut has a majority of immune cells. Also, it's a large part of your immune system. Also, as a barrier to keep things that are adverse stimulants out of the bloodstream. We can see leaky gut syndromes and hyperreactivity syndromes, that and the other thing, because they will overreact to it and produce yeast and or bacteria. And remember that it's an imbalance of the flora on the skin. It's not necessarily put more yeast on the skin. If we kill off the good bacteria, it cannot keep the yeast, so the yeast will overproduce, and then you have a yeast infection on the skin or in the ears. Comprehensive and
Christine is on. Yeah, Christine, we were hesitant to even come on tonight because we're having Dr. Canizaro's having some Wi-Fi issues, so we're struggling. Are you able to get any of it? Because I don't want to waste this knowledge if you are not even able to get some of it, because yeast is so important, and I think it's misdiagnosed sometimes. I think groomers and veterinarians sometimes just instantly say it's yeast, and then they start treating it like it's yeast without actually running cultures. But Christine, if you could type in if you're getting any of what Dr. Canizaro is saying, because like I said, I don't want to waste Dr. Canizaro's time if nobody can get this information. I think it's easier for me to decipher what you're saying because I am inundated it, but it may not be much for other, because we're getting about she says pretty much she can get it. But I think what I would ask you is, if I suspect that my dog has a yeast issue, okay, so I think he smells, he's got stuff, what test should the veterinarian be doing before treating?
Well, it's a look at the organisms under the microscope, which can be done very easily either on the skin. That way we can identify if there's the presence of bacteria or yeast and approximately what the ratio is. Because you're right, even bacterial infections on the skin can, statistically speaking, yeast infection in the ears and on the skin, a yeast infection it's extremely itchy for pets. So it's even more irritable infections are. It's important to know, I would say that, which I'm not, it would be important to know so that you have some idea of maybe how you're. Sadly, though, in allopathic medicine, it's all about antibiotics, steroids, or which doesn't treat the underlying imbalance, because again, the bugs are not the problem. What is the problem is why the system is out of balance. Help the animal to get back into balance again, so that the flora and the checks and balance, so you don't have an overgrowth of yeast or an overgrowth of bacteria, or for that matter too.
So Christine, that's what she's trying to answer for me. What she actually beautifully answered is that we want to have a test done, because you can't always tell just by look and smell whether it's bacterial or yeast, or if it's both. And so what Dr. Canizaro is saying is to have your vet run these cultures, so we know exactly what we're dealing with, because without those, we can make mistakes and go the wrong way. And I think that's what is happening a lot. Is I have people bringing in.
We can look at it under the slide. We don't actually have to spend money on a culture, heck, bent on putting them on antibiotics or antifungals. Then you better know exactly what. But that said, we can look just under the microseed budding yeast or round bacteria or rods, which are the rod-shaped bacteria. We can looking under the microscope even without a culture, and that is less expensive. So if you're thinking about it, you don't necessarily have to spend the money in the culture. I just wanted to be clear about and others for that.
Thank you. So we can just ask our vet, hey, can you just look at this under the slide and tell me, if I've got a yeast or a bacteria? It should be a lot less expensive doing that, right?
It is a lot less expensive. Diane is having a hard time under half of what I'm saying.
Half of it is hard to get. I know it is so hard. That's why I'm trying to get what you're saying, and then I'm telling them because I can kind of get it.
I get that.
Yeah,
doing a good job, I might add.
Yeah, I'm like, okay, I know what she's saying. Okay, so what we want to do, guys, is if you have a pet who is itchy and maybe has stuff coming out of the ears or maybe smelly or maybe they're not smelly, we want to actually have your veterinarian grab some of the stuff out of the ears, look underneath the microscope. Dr. Canizero says it'll be a lot less expensive, and start there, so at least we have something to go with. For me as a groomer, what's happening is I have all these dogs coming in with these antibacterial shampoos, these really harsh antibacterial shampoos. And what is frustrating for me is that if that's yeast and we're using antibacterial, it's like an antibiotic, right? So now we're killing off the good bacteria that might be able to keep that yeast a little bit at bay. So that's why it's important. And that's why I wanted to talk about it with you, is because people are always asking me, my dog, they tell me my dog has yeast. What do I do? And then I say, did your vet tell you it's yeast? Did she look for a culture? Did they run a test? Or do you just think it's yeast? And they always just come back with, well, I think it's yeast. But it matters.
Pretty characteristic odor. So many veterinarians will rely upon, which maybe I should applaud allopathic veterinarians for, because they rarely use their evaluate, examine, diagnose animals. So I think that's something that's missing, not be missing in our practices. I certainly use pretty much all of my senses. The thing to be cognizant of is that, if we have yeast over, I always ask, what are you feeding? Yeah. I mean, if they're on commercial, it's highly processed foods, even if it's veterinary prescribed foods, because they're not going to get better on those. I don't even care if it's the prescription diet for allergies and hydrolyzed proteins, or it doesn't matter. Those are not going to fix the problem. And if they do tend to cause any kind of improvement, it's usually why, because we're using the diet sort of like medications. We're over the problem until the problem breaks through that Band-Aid. It's too late to keep it covered up.
Dr. Canizero is saying that you really have to look at what you're feeding, because even if it's a prescription diet, she says, even if you're getting these prescription diets, it could be contributing to your problem and certainly not helping your problem. So you really have to look at what we're feeding. She also mentioned that there is a very distinct smell to yeast. So a lot of times vets will say, well, it smells like, if it looks like it quacks, like all that kind of stuff, they'll kind of go that route. But for you guys at home, yeast does have I've had people tell me that it smells like Fritos. That's the most common thing people tell me that it smells like is Fritos. I just think that's funny. I guess I haven't had too many Fritos in my life, because I'm like, it smells like Fritos. I don't think I would ever, I feel like Fritos is a food people would want to eat. And so I think it's weird to say that it smells like Fritos. But apparently, if your dog
now that it smells, I'm going to eat Fritos.
What?
I said, now that we identify like Fritos, no one is going to want to eat
no
Fritos.
No one's going to want to eat Fritos again.
Good food
because it smells like yeast. So when we're looking at I had talked about the antibiotics and antibacterial shampoos. Oh, let me ask this real quick. My cat is so scared of strangers, but I want to get him to a vet for a blood test and addressing the itching. Would you recommend a calming collar? I don't know what that would do to make his itching worse. Why are you trying to get him into the vet? Are you trying to get him into the? Are you trying to get him? Oh, addressing the itching. I don't know what that would do in making his itching worse.
Why need a blood test for the itch? Blood work is a good idea depending on the age of the pet. So Christine might be cis. I don't know that there's a calming collar. If your cat gets really fractious or very extremely difficult to handle, what I work with my homeopathically first, one, it may help with the itching, and number two, the anxiety, the fear, and the high reactivity, provided that he's a reactive. He's only 2 years old, so he may or may not need blood work. But I would focus, if he's so scared, I'm not really sure a calming collar might help. You could try rescue remedy, which is but homeopathic treatment would be ideal and would certainly address the fear and the anxiety of going to the vet.
So Christine, she says, I think we were able to get a lot of that, but she's saying that she doesn't think that the calming collar would cause more itching and that you should get him into the vet to see
I don't
what's
think
going
it would help.
You don't think that the calming collar would help?
Not enough if the cat is. I don't think the calming collar would help enough to make enough of it. It would only be helpful if the cat actually has like a anxiety condition. If a cat is literally itchy or has itchy allergies, calming collar would help very much. And if she's looking to the calming collar to help to get, I think it would be like bringing a pail of water to a forest fire. It'll help a lot enough.
Yeah. I can say, from someone who owns a cat hotel, and I see a lot of kitty cats, and I have my own 4 cats. When a cat is in that kind of extreme panic and leaving their environment and their home, I've never seen a calming collar work. So I mean, I've just never seen it work. And sometimes I've always thought, God, by the time you get that thing on the poor cat, that freaks him out more than just doing it and going and doing it. So,
well, it depends. It depends if they're accustomed to wearing a collar. I mean, a lot of people have collars on their cats. I do, because I don't really like microchips because of the electromagnetic that it produces. So I tried. One cat won't allow it, with identification tags on, and it kind of fell by the wayside. So I just have to escape and run off.
Yeah. I'm just going to throw this out there for you, Christine, because it's such shocking how many times this simple little thing works for cats that are itching. Get rid of your cat litter. Try just temporarily ripping up some newspaper just for like a week and see if it works. Because I cannot begin to tell you how many animals sneezing, upper respiratory, itching, all that kind of stuff is a simple get rid of it, all cat litter, and put in just newspaper and see what happens. See if you start to see a little change. And then if not, from there, given that you have such a stressed cat, I would say try that. And if it doesn't work, then you're going to probably need to go in and, like Dr. Cannizzaro was saying, and get those tests done and see what you can find.
She may not be as that stressed out. I'd recommend homeopathic treatment before that out and going for blood tests, which may or may not reveal anything. Looking at diet, treating homeopathically. Homeopathic treat both the itchiness, any emotional overgrooming, anxiety, or any fractiousness. Her cat is really fractious at the vet's. That's mental state and physical state in the best condition and then she may not. Seeing Dr. Dim.
Yeah.
I don't
She's
know what
seeing
test
Dr. Dim.
doing.
I have to see the local vet. I know. Yeah, I was just going to say maybe there's a homeopathic something that she could, but Dr. Dim will be able to help her. But
I would address
maybe
that.
there's some, address
That's
what?
I would address the anxiety, but that will be concurrent with the itchy skin. So both of those will get treated at the same time.
Yeah, you know, that's what,
before trying to get testing done. Sick.
Yeah.
Not eating, lethargic. You know, it needs to go in.
It's so hard to hear you. I'm trying to get some of the words that you're saying. I know we're going to probably have to go because I'm even having trouble getting it. I think that what you were saying, and just correct me if I'm wrong, is that possibly the anxiety and the itching are kind of connected to the gut, and we should be addressing the gut. Is that what you said?
Plausible possibility.
Yeah, I'm having a hard time.
Homeopathically to treat all of those symptoms for a cat, going to the veterinarian to have testing done. I don't know if
we got a little bit of it. I think we're gonna just, because I don't want to get Dr. Dim has him on a couple of things for his gut. That's good. Dr. Dim's great. He's gonna be able to help you. Oh, my cat has. Oh yeah, here. You want to meet my Pika cat? Yeah, I got one too. It's very frustrating. She's young, so I'm hoping I can fix her. But yeah, we talk about Pika on the show before because my cat suffers from it. It's awful.
And
it's
awful. that is treatable homeopathically, and that needs to be addressed homeopathically.
Yeah, I need to do it. So I think just because we can't hear you, I think it would be better if we're going to get another date together. Dr. Canizero and I'll figure it out after. We'll get a date together and we'll come back on because you don't want to miss what Dr. Canizero has to say. It's pretty amazing. And I'm getting like every fourth word at this point. So I'm going to let you go so you can get done.
So sorry.
It's okay. It's okay. We'll get it figured out next time. I hope though that we were able to give you guys some insight into yeast and just a little bit there, but we'll come back on. Keep updated with us. We'll let you know when Dr. Canizero is back. So probably just be in a couple of days. So I'll keep you guys updated, but thank you so much for joining us. I'm so sorry. It's just important that you guys are on here. I love the questions, right? Because the questions are so great. They help so many people. So,
yes.
All right, guys, we're going to go ahead and let you go. We'll see you soon. Dr. Canizero, I'm sorry. We'll get it figured out.
I'm sorry.
All right.
So sorry.
Have a good night.
Thank you. You too.
Thanks. Bye-bye.
Bye. Criminy shit.